With tens of thousands of pages of new regulations, individual and corporate exposure to new tax penalties, new terms, new plan designs, and insurance premiums going through the roof, it's time to find new ways of looking at old things. Over the years, the healthcare industry, the insurance industry, employers, and the government have put the healthcare Legos together in a variety of convoluted ways. Today, due to ACA, those Legos have to be taken apart and reconstructed in a completely different way. Employers are fatigued with worries over new ACA terms, new eligibility rules, new plan designs, new expenses, exposure to penalty taxes, and many are even worried about their ability to afford to stay in business. Employees are worried about what they should do, what they're required to do, and what happens to them if they don't do what's required by the new law. They're seeing for the first time how their deductibles have gone skyward, how their overall out-of-pocket exposure has gone up, how their doctors are no longer in the PPO networks available to them, and a variety of other issues relative to how they're going to make their financial ends meet. Insurance agents have been inundated with volumes of new regulations to learn and are living in a politically charged business environment. Agents are having to figure out how to balance benefit costs with minimum value requirements and penalty tax exposures within a business environment where rules can change at the stroke of a regulator's pen. The insurance industry has not traditionally been very creative. As a matter of fact, the phrase insurance industry creativity is as much of an oxymoron as the phrase government intelligence. In order to comply with ACA, the insurance industry has to deploy a completely new set of creative risk-taking techniques, such as shared risk-taking and other refreshingly new adaptations due to the new law. We at Key Benefit Administrators have to deploy all of our administrative capabilities, risk-taking skills, and proficiencies of the terms and conditions of ACA towards providing solutions to the complex problems created by ACA. It's the time for creative packagers of goods and services which solve business problems to step up with real solutions. With that in mind, we want to introduce you to the newest, most cost-effective, compliant MVP model created through new ways of looking at old things. In order to do that, we need to cover a number of terms and the definition of those terms. The first is Minimum Value Plan, or MVP. Effective 1/1 of 2015, employers employing 100 or more employees must offer an MVP. The MVP must meet the government's 60% rule of allowed cost. If the MVP is self-funded, certain benefits can be excluded from the plan design, which we'll explain in a moment. However, effective 4/28 of 2015, all MVPs must include substantial in-hospital and physician benefits. Effective 1/1 of 2016, employers with 50 to 99 employees are subject to the same MVP rules. Next is the term affordable. The MVP is affordable as long as employers do not charge more than 9.5% of an employee's W-2 Box 1 income. The W-2 Box 1 income equals the employer's total income minus his or her contribution to a pension plan and minus any monies he or she set aside in a Flex 125 program. This limitation applies only to the single contribution rate of the MVP, but not for the charge attributable to any dependents under the Safe Harbor rule. Next is the term A-tax. The A-tax is assessed as a penalty to employers if employers do not offer a MEC plan, which again we'll explain in a moment. The tax penalty is an excise tax, meaning that it is not tax deductible to employers. The tax penalty is $2,000 per full-time employee. Employers employing 50 to 99 employees will be exposed to this penalty tax starting 1/1 of 2016 for all full-time employees less 30. Employers employing 100 or more employees were exposed to this penalty tax starting January 1 of 2015 for all full-time employees less 80 for 2015 only, then less 30 thereafter. What's the B-tax? The B-tax is a $3,000 excise tax penalty assessed to employers if they don't offer an affordable MVP. Employers are assessed a $3,000 tax penalty per employee who is eligible for subsidies on the exchange, who waives off the employer plan, and who purchases coverage on the exchange. How much is the individual tax? The individual excise tax penalty is charged to employees who do not purchase the minimum essential coverage which is required under the law. For 2015, it's the greater of 2% of modified adjusted household income, or $325 per adult plus $162.50 per child, and for subsequent years, it's the greater of 2.5% of modified adjusted household income, or $695 per adult plus $347.50 per child. Next is minimum value. Minimum value is defined by the government as a plan which provides for at least 60% of allowed cost of payable medical bills. Another way of saying this is that the plan has an actuarial value of at least 60%. CMS provides a calculator which will determine the minimum value of the plan if the plan design can be accepted by the calculator. EHBs are next. Essential health benefits, or EHBs, are defined by the government. EHBs are categories of benefit coverage which must be included in benefit plans if the benefit plans are fully insured. With the exceptions of in-hospital and physician benefits, benefit plans which are self-funded do not have to include all of the EHBs. However, don't forget that even though self-funded plans do not have to include all of the EHBs, self-funded plans must meet, at a minimum, the 60% rule under the definition of minimum value. What is a non-standard plan? The CMS calculator, which determines whether the minimum value of a plan is at least 60%, could not be constructed in a way that every plan design could be entered into the calculator. There are simply too many variations of plan designs in the market for the calculator to handle. Those plan designs which the CMS calculator cannot make the minimum value calculation are considered non-standard plans. If employers use non-standard plans, they must hire an independent actuary to certify that the minimum values of their plan designs are at least 60% as defined by the government. And yes, these values, which are independently determined by private actuaries, can be contested by the IRS. What is a standard plan? As you may have already guessed, a standard plan is a plan design which fits into the CMS calculator, enabling the CMS calculator to determine the minimum value of the plan. The government has written that employers can depend upon the results of the CMS calculator as long as the benefit plan matches the benefits entered into the calculator. In other words, the results of the CMS calculator cannot be challenged by the IRS as long as the benefits match those entered into the calculator. Hence, there is no need for an independent actuarial certification when the CMS calculator is used to create a standard plan. What is a target loss ratio? A target loss ratio is not a term used in ACA. However, it is a term we're introducing within the new most cost-effective compliant MVP. The target loss ratio, or TLR, limits the amount of profit the insurance company involved with the new MVP can make. By limiting the amount of profit to the insurance company, two primary things occur. First, since the new MVP is self-funded, all funds remaining in the benefit plan not used for claims and expenses remains in the possession of either the benefit plan or the employer. By limiting the amount of profit for the insurance company, funds remaining in the possession of the benefit plan or employer are maximized. Second, since the TLR calculation is incorporated in the benefit plan agreement, transparency is achieved. Employers will know what the loss ratios for the MVP are and how the profits to the insurance company are limited. What is a MEC plan? MEC stands for Minimum Essential Coverage. The minimum essential coverage which an employer must offer to employees in order to insulate itself from the A tax is the MEC plan. The MEC plan covers 100% of the CMS-listed preventive services. The minimum coverage employees must purchase in order to insulate themselves from the individual tax penalty is the MEC plan. What is a MEC-heavy plan? A MEC-heavy plan is a benefit plan which provides the CMS-listed preventive services plus other significant, meaningful benefits. Therefore, it provides significantly more benefits than the MEC-only plan, all at a surprisingly affordable cost. It does not qualify as an affordable MVP, however. Therefore, we have added the new most cost-effective compliant MVP. The MEC Heavy, and the MVP work in a consolidated way to make affordable sense out of this very complex law. So welcome to the new Key Solution 5M program. The new MVP has been constructed to be the most cost-effective plan in the market using new ways of looking at old things. MVP rates are set at the time of proposal and do not vary by the percentage of people enrolled. In most cases, the after-tax employer cost will be less than $50 per month per employee participating in the Key Solution 5M program. Uniquely, there are no participation requirements for the MVP, even though it includes full in-hospital and physician benefits as required by the new government regulations. It incorporates features which utilize the ability to exclude certain EHBs, a target loss ratio which limits the insurance company profit-taking, a highly acclaimed patented chronic disease management program, a special diabetic program, an advanced employee search engine enabling employees to compare the prices of healthcare services, and a number of other modern-day creative risk-taking techniques. Additionally, it's a standard plan which meets the minimum value as required by law, and since it was created through the use of the CMS calculator, independent actuarial valuations, which can be challenged by the IRS, are not needed. It insulates employers from the ACA tax liabilities, insulates employees from their individual tax liability, while providing meaningful benefits and benefit choices to employees and their families. The Key Solution 5M program does all of this at a surprisingly affordable cost.